Members, we have a quorum and it is also the appointed time for the meeting. Let me first of all welcome the 20 deputations. Today, we are talking about regulation of private residential care homes for the elderly and for persons with disabilities. We welcome the representatives of the administration as well. You know this is an old topic. This is really about the quality of private homes. Private RCHEs have been with us for a long time. RCHDs have also been with us for some time. The law has also been implemented. These private homes are in the market. They play a particular function. And in terms of RCHEs, 70% of RCHE bids are provided by private operators. Some of them, of course, are bought places. All along, the quality of private homes has been criticized. The standard varies quite a bit, and some of them are of very low standard and are quite unacceptable. Given our economic level today, if you look at the environment in some private homes, well, on the average, these are typical examples. And these are really pictures from the media. I can say that they are far from satisfactory. We are an international city, and when elderly people are in their twilight years and they are crowded into partitioned bed spaces, well, there is no way there is any privacy for them. And even if you have cubicles which are partitioned, they are occupied by more than one elderly person. I don't think anyone would particularly like to be in these circumstances. It is crowded and it is also lacking in facilities. If elderly people have difficulty moving around, maybe they are visually or impaired and also audioly impaired, then they will have grave difficulties. And of course, we have heard abuse cases as well. Sometimes elderly people are beaten. I believe I'd like to share these with you. The administration has given us a paper. I hope will allow the deputations to speak first, and the administration can respond later. We are limited by the meeting time, which is going to be for 2 hours. I hope the deputations can speak within 3 minutes. And the usual practice is that when you speak, you are not going to be protected or exempted by the Legislative Council Powers and Privileges Ordinance, and you are going to be responsible or liable for what you speak. After you have spoken, the administration will respond, and then members can also ask questions. If members ask you questions, the deputations can also answer them. First of all, New People's Party, Mr. Ng Ka-chiu. Chairman, members, I am Ng Ka-chiu from the New People's Party. There are many elderly people in Hong Kong, and the number of elderly people with sicknesses is increasing, and also there is an aging in the disabled population. We need to have quality services to help this group in the community. In Hong Kong, we have always lacked the supply of private homes. And in fact, 70% of people in private homes are CSSA recipients. However, the CSSA payment is not enough to pay for non-bought places in private homes. So some homes are cutting down on cost, and as a result, they do not provide appropriate and reasonable service. And that is why the standard varies quite a bit around private homes. We would hope that the $275 supplement would increase to $1,000, so there will be a lesser burden on the elderly people in paying their home fees. and so that homes will have more money to provide services. And also with the licensing of RCHDs, the lotteries fund is providing money to do refurbishment and improvement in RCHDs so that they will comply with housing and fire installations requirements. But then there is also a part of improvement project which is to be self-financed, but this has become a heavy financial burden for the RCHDs. The NPP is of the view that apart from economic provision, you can provide interest-free loans to help private RCHDs to do something about their hardware, for example, safety installations and home design, so they can comply with licensing requirements and make sure that the people are safe. As for the per capita space and also manpower complement, I think they should provide a level of service which is higher than the norm. However, even if some homes are in the Bod Place scheme, their space and manpower complement are not up to standard yet. So we expect the administration to step up inspection and also to make sure that they are implementing improvement measures. You should also step up the implementation of the law. Our major premise is quality of living and also safety for the inmates. I hope you can accept our views so homes are legal in their operation and inmates are given appropriate service. Thank you. Next, Mr. Thomas Kwong, Hong Kong Private Nursing Home Owners Association. Thank you, Chairman. Just now, Mr. Ng said that there are a lot of problems with the hardware. When we look at quality and monitoring, I believe we should also look at the human factor. He mentioned that 70 to 80% of our elderly people are on CSSA. To the LWB, the CSSA is not for paying home fees, but private homes usually make use of the $4,000 to $5,000 to pay rent and also salaries. Those two take up 70% of our cash flow. So you can think about this. Do we have money to help us hire good people? I have seen members and other people and trade unions saying this in the media, that why don't we pay our workers more? Now this is one of the reasons. If you do not have good workers, how can we have quality service for the elderly? It is not that we don't want to do a good job, but we hope the administration will help us, will find a way to help us so we can do a better job together. I understand we have a management problem, but let us look at our work processes. We have been operating for 20 years. If you say our work processes are problematic, does it mean that we can patch up the surface? If you know what is theory of constraint, you will understand that if you mend one side, the other side will break. This is what is happening in private homes. Recently, together with the TID, we have got funding from those, and we are going to help private homes with pharmacy service. We'd like to have a process re-engineering. So whatever we can do for the homes will hopefully enhance the level of service. But very often the administration does not cooperate. We need to go to pharmacists through the Department of Health, and then the SWD said that our electronic signature is not up to the standard, and then we had to spend one whole year to go for the visiting pharmacist services. We would photograph each and every tablet, and then we would give a wristband to every elderly person, and everything is stored on an iPad, so we make sure that drug issue will not be misdirected. We wrote a proposal to the TID saying that we would like to build a home for 500 elderly persons. But then if you ask us to have two systems in one home, we are not going to be able to function. We have health workers who are licensed, but care workers are not licensed. They learn different things, but we need continuous education for them so they can learn something from time to time. Like health workers, we have 13,000 of them who are licensed, but only 3,000 of them are working. Where are the other 10,000? Maybe they want to rejoin the trade 10 years down the road, but then the knowledge would be outdated, and then we need to help them update their knowledge. So there are so many problems, but I'd like to take the opportunity to help you understand that private homes are not here just to get more money, but we'd like to work out a workable solution with you. Thank you, Mr. Kwong. This is exactly what we're trying to do here. Next, Ms. Chung Yut Kam, Carer Alliance for the Dementia. Thank you. I am Chung Yut Kam. We'd like to propose aging in place. We hope there will be community care for the elderly. The administration should help so elderly people do not need to go into a home. If the old people who have dementia stay at home, sometimes the care needed is going to be intense. And in fact, 80% of elderly people in homes have different degrees of dementia, and therefore we need to provide quality service to them. This is more serious for private homes, especially those which are in remote places. It's very difficult for them to hire local people, and who are left behind in the homes are working doubly hard. Some of the elderly people who have dementia cannot take care of themselves, and they have short temper, and it's very difficult to care for them. And in the end, because of a lack of manpower, the patients do not get quality care. And very often these patients are prone to wander away, and they cannot come back. And in order to save time, staff would put them in straitjackets, and they therefore do not have freedom or mobility, and in the end their temper is even worse. Staff should have the time and also the right mindset to listen to the patients and communicate with these elderly people so as to give them holistic care. The administration should provide more assistance to such workers by also providing training for them so they have more knowledge, they have more expertise to know the needs of the patients. I think also facilities should be enhanced and improved to meet the needs of the people who have dementia. You should also step up your inspection to make sure the homes are safe. The Labor Inspectorate should go and inspect these places more. You need to see why they have short temper, and you have to make sure that the drugs they get are not wrongly distributed. Thank you.
Next, Mr. Kok Wah, Chairman. I am a member of the Carer Alliance for Dementia. Today, I would like to share with you my personal experience. When my wife was admitted into a private board place residential home, I personally made some inquiries and to find out the conditions in the home. But when I reached the ground floor of the residential home, I already could smell a very strong odor similar to the smell coming out from the toilets. So the first impression was really not very good. And when I went up to the premises, I found out that the environment was really very, very confusing. There was no privacy at all, and all the beds are actually put one next to the other, and the staff who should have been wearing white uniform, but those uniforms were already grayish in color, and the accent shows that they are recent immigrants, and I don't think they have ever received any professional training. I think they really lack such training. Because of that, I decided not to have my wife admitted into such a home. I would rather wait for her to be admitted to the subvented homes. I think the government should monitor more closely the staff of such homes. Is it because of the financial constraints that they hire such low-paid staff? Well, that's one question. And secondly, do these homes have sufficient facilities to look after those with special need, in particular those who are physically disabled or those who are suffering from dementia? I don't think such homes can really satisfy our requirements. And because of that, I mean, like my wife, for example, she would need to be fed. And I don't think such homes have sufficient manpower to feed the patients. So I hope the government will pay more attention to the need for training for the staff working in such homes. Thank you, Mr. Ng. Next, Madam Alice Lee. Thank you, Chairman. My parents have suffered from a light stroke, and they also suffer from the terminal stage of dementia. They had once been admitted to a private home, but because of the quality of service there, I arranged for them to live with me instead. If there were no problems with the service in such private homes, I wouldn't have made such a decision. So I'd like to highlight 2 points. First of all, the question of fees. I understand that the private homes charge around $9,000. The miscellaneous fees would range from would start from $500. Does the government have any standard governing the fees that they charge? And secondly, how does the government determine whether or not such homes are providing reasonable service? According to my experience, they always ask me to pay additional fees for diapers and nutrition powders. But do they need to have so many diapers changed, or are they really fed several times such nutrition powders? I simply don't know. Secondly, the question of surprise visits. I have studied the RCHG ordinance, and I understand that there are a total of 7 unannounced visits in a year. But someone from the homes asked me why such homes are not announced beforehand. Now, if one day you discover that you need to be admitted to these homes, would you be really happy? I personally believe that we would be scared. We'll be scared that we'll be fed human feces. We're worried that we'll be stripped and then have to line up to be bathed. And we need to, beg for the favor of the staff. We need to go to the toilets. And if diapers are wet, they will not be changed for many hours. If the homes are not properly monitored, then these problems, if they were these homes properly monitored, these problems would not have occurred frequently. I'm sure the professionals are aware of such a situation. If you say you don't know, then I think you are an idiot. If you don't know and you don't deal with the problem, you are an accomplice to the wrongdoing. Thank you. Next, we have Mr. Lam Wai-shing from the Alliance for Residential Care. Private homes, regarding private homes, our Alliance believes that private homes is only an additional choice for the users. In the long run, the government should provide for more places in subsidized homes for both the elderly and the disabled. We also believe, and we request that the government should enact legislation to protect the rights of the disabled. And in the long-term plan of the government, I don't think just because of the change in administration, the projects would be affected. I hope the government will also improve on the existing facilities of these homes. Not only we do not just want some minor, renovations to these homes, and we hope there could be a holistic plan to plan for the redevelopment of these homes, so that we can expand and redevelop the older homes, so that we can satisfy the standards as prescribed in the RCG ordinance. The workshops are. I think the graduates from special schools cannot be admitted to the workshops for training because those who are working there already are getting old. I am particularly concerned about the need to provide for one-stop service for these people. For residential care service, we believe that financial support is very important, especially for the subsidy for the disabled. The government is now willing to provide for a subsidy for the carers of the elderly, and not at the same time consider offering a subsidy to those people who are caring for the disabled. I think the government should consider this. For temporary residential service, in many emergency cases, one has to go through interviews and physical checkup. As a result, the patients are not able to get immediate service. We suggest that the government should set up in different districts special homes to look after, to provide temporary shelter for those in need, so that they will get so that the needs can be taken care of. And disabled, we believe, should be able to apply for CSSA in the personal capacities. To allow them to apply for CSSA in the personal capacity can improve the financial status and also improve the relationship with the families. And as a result, the quality of life can also be improved. Thank you. Next, we have Ms. Lam Ling from the Fourth Right Caucus. The Fourth Right Caucus is concerned about the shortage of manpower and the question of labor import. We understand the labor shortage has an adverse impact on the quality of service. However, working in these homes is an offensive trade, and the salary is not very attractive. As a result, these homes are not able to attract many people to join the profession. Many young people are also unwilling to join this profession, although the law lay down the manpower provision for these homes. But in reality, the number of carers in these homes are not sufficient, especially the private homes. In the government's paper, it highlights the point that the SWD's visits are announced beforehand, but some deputations have already pointed out just now that the homes are actually informed beforehand, before these surprise visits, and very often the homes will simply, recruit some temporary staff to work at home when the surprise visit takes place. And some homes would, spend money to procure the service of therapists. It is stipulated that they work from 8 to 8, but in fact the therapists will only work from 10 to 5. But according to the record, they work for much longer hours. So if you just check the record, you won't be able to find out that there is a problem. The shortage of manpower would also adversely affect the monitoring of the staff's performance in such homes. We've heard about that because of the manpower shortage, and even though the service provided by these carers are not satisfactory, they dare not dismiss these people. Under the circumstances, how can the quality of service be improved? We're also very concerned about the import of labor and how it affects the quality of service. The Labour and Welfare Bureau announced just now that very soon the residential homes with bought places will be allowed to import labor. I've heard about a case that a staff who dispensed a drug was an imported labor, and he dispensed the wrong medicine to the patient. What's going to happen if this should happen? Some deputations also mentioned that the carers in these private homes are being exploited. When the salaries are to be paid, the employer will ask them to refund $2,000 to $3,000 of salaries to the employer, and they also ask to work overtime without pay, or the wages are being they're not able to collect the wages in time. So I think importing labor will not really solve the problem. Finally, I'd like to reiterate what the disabled want. They want to they can only choose to live in these homes, but there are insufficient places in the subsidized homes, so they can only go to the private homes. While we need to be concerned about the quality of service, we're more concerned about the welfare of the elderly and the disabled, and I think there should be a comprehensive, long-term, caring service for these people. Next. Mr. Harris Young from the Liberal Party. Our population is aging, according to government statistics. Those over the age of 65 is increasing, and in 2001 they made up 11%. Now they are already up to 40%. By 2012, the number exceeds 1 million. So the aging problem is a major challenge facing us. The demand for residential care services is increasing all the time, but there is a serious shortage of subsidized homes, places in such homes. So in the past, the government, resorted to the enhanced bought place scheme to buy some places from the private homes. According to the SWD, from 2010 to 2012, only about 750 bought places have been provided into the service. The quality of service and the monitoring of such service in private homes has always been a concern of the community. In order that the elderly can age properly, we think the government should increase the number of such bought places, and for those people who cannot wait for them to be allocated places, homes, we suggest that the government should review the model of and that we should give $5,000 to elderly people who are eligible, so that they can choose the homes of their choice and also age in place. The government should also address the question of manpower shortage for these private homes, and more training should be provided, and more young people should be attracted to join the profession, and the government should consider allowing more resources to enhance the service quality of the RCHE and the RCHD, and without affecting the local employment, the local workers. The government should consider the importation of labor in order to relieve the labor shortage. Next, Ms. Lam Chi Chung, Irene Lam from AIDS Concern. What we want to say is that the private homes are refusing to provide service for elderly persons who are HIV positive, and these homes say that if we admit these HIV positive patients, the staff will not be willing to look after these elderly persons, and this is not an isolated case. Of the with support of the intermediaries from 700 homes, we're told only one home is willing to accept such HIV patients. So 99% of the homes refuse to admit them. Actually, HIV is not cannot be transmitted from person to person. Professor Ho said that this is only a chronic disease, and one can only attract AIDS through sexual contact, but in the course of daily life, you will not be infected. For the residential homes, they do not need to use any special equipment to look after elderly patients who are suffering from AIDS. The staff so using the pretext of refusing to provide service to the senior citizens suffering from AIDS is likely to contravene the disability discrimination allowance. According to the Code of Practice of the SWD, that is, in the training materials for homes working in these homes, there is no information relating to how AIDS patients should be looked after. Hong Kong, our understanding of AIDS in Hong Kong is still very backward.
In the US and the UK, there are many workers who are familiar with AIDS patients, and yet in Hong Kong we are really backward. You are even breaking the law. Last year, 53% of the AIDS patients were over 50 years old, and since 1984 we have got 6,000 cases, and our population is aging, so those who are AIDS affected would also be getting older. But then one case of discrimination is one case too many, and this is going against our human rights protection regime. When an AIDS patient is turned away from the homes, how can you say that we are providing services to our elderly people? Is it that elderly people with AIDS are not deserving of a life with dignity? I'd like to make the following observations. The SWD should penalize law-breaking RCHDs and RCHEs when they apply for licenses or renewal of licenses. There should be the Department of Health's participation, so there would be more knowledge about AIDS. And the Department of Health and NGOs can cooperate, because we are very happy to provide services and will continue to monitor and investigate cases. Thank you. I think this is a very serious issue, and I would actually like the administration to respond. Ms. Lee Xiu-ying or Edith. I have been a social worker for over 20 years. I think the difference between a government home and a private home is very big. You can say between a guest house or a five-star hotel. All these years, many people needed to apply for a home, but some families would say in a government home it is like a five-star hotel, but a private home will be in shambles. The operating mindset is totally different. The manpower quality is also totally different. Private homes are not anywhere near the subvented homes in quality. I would say if private homes continue to operate, they are not the best option for elderly people. Government homes or subvented homes may charge $15,000 to $16,000 per person per month. And if it is a private home, the subsidy is just a few $1,000s. In fact, the administration doesn't really like to take up the tab. And you talk about aging in place and community care, but you don't give enough manpower to the private homes, and some people are not allowed to stay the night. Subvented homes are operated by the government. People have better qualifications. But in private homes, very often it's a family business. Uncles and aunties may operate the home together, but they are just a health worker, perhaps. So they do not have the capability or the will to provide good service to the elderly, and they have no particular conviction to help elderly people stay healthy. But in a government home, they have a physiotherapist, occupational therapist, etc. So they can stay healthy and alert for a longer time. But in private homes, if an elderly person goes in there, they deteriorate really soon. Talking about health workers or care workers, let me be frank with you. I have interviewed many applicants. They might have the license, but they can't work independently in a practical environment. if it's a fresh graduate from a training course, they do not know what to do. They have to be supervised. But then those who supervise them are not qualified. Many people give me a certificate, but I test them and I said, take the blood pressure, and they don't even know how to do it. So the license doesn't mean they are qualified for the work. And competition is fierce. Many private homes and even surrented homes call me up for manpower placement. I hope there will be a comprehensive plan for the administration to gradually reduce the number of private homes, or you give them enough subsidies so they are at a par with government homes. Next, Ms. Chen Mo Chen. Actually, I belong to SOCO and I'm just an average citizen. I worked in an elderly home. Let me tell you what actually happens there. Why is the standard at RCHEs so bad? It is because of a lack of manpower. Private homes charge much less than surrented homes, so they hire fewer people. Surrented homes provide better service because they charge more, like where I worked. Let me tell you this. Sometimes a worker has to look after 30 to 40 elderly people a night, and I can tell you one actual case. Some elderly people are totally immobile, but the worker has to go off the shift at 7 a.m. Now, how can he or she help these people? So they would ask the elderly people to get up at 3 a.m. or 4 a.m. and they are tied to a wheelchair. And suddenly, the one elderly lady died, tied to that wheelchair. It's really very sad. The lady could not even die on a bed. And then there was another elderly person who was discharged from hospital at night, and he or she was taken for a bath without having breakfast. And I was preparing hot water myself, and it was said that, never mind, it's already 9 o'clock, let her take the bath because at 10:30 there will be a meal. But then in the end, the elderly lady also died. I can tell you one third example. The elderly lady was tied to a chair in the sitting room for porridge. She could not swallow, but then she was force-fed, and in the end she choked and died. Many old people die this way. This is because private homes charge so much less than surrented homes, and one worker has to take care of dozens of elderly people. Therefore, the quality is poor. I can sympathize with them because I worked in one of these homes. I know the difficulty. I hope there will be more subvention. 80% of private home inmates get CSSA, and they can only pay with the CSSA amount. This is one factor. And as the other lady said about drug distribution, in our home, only licensed healthcare or health workers would distribute drugs. No care workers would be allowed to distribute drugs. Thank you very much, Ms. Chan. Thank you. But what you described was really shocking. Those are real facts. I have left the home. I'm not working there anymore. That is why I dare say this, or else I would offend many people in that home. Your time is up, Mrs. Chen. Maybe you would have a chance to speak more later. Next, Mr. Kwok Chin Yin from Hong Kong Elderly Rights Alliance. Thank you, Chairman. As you can see, am an elderly person and I'm from the Alliance. We are in touch with elderly people day in, day out, and we know the situation on the ground and we know the misery of elderly people. But the government says that they would like us to have a sense of belonging or allow us to age in place, but what they do is opposite to what they preach. As you know, elderly people always are sick, and if you need medical attention, it's so difficult. If you go to see the doctor once, they will ask you so many questions, and then sometimes you need to be hospitalized, but it is so difficult. Even if you are already using a wheelchair, they would say you are not really disabled. So I really don't know the rules. We have no one to turn to. We have no one to help us. And some of us are on CSSA. We have $6,000. But we have to pay $8,000 to the homes. We pay up the entire amount of assistance, but it is not enough to pay the home. So the government has a lot of money. It's not that you don't have money. Please take care of us. Take better care of us. This is apt to bring tears to the eyes of anyone who hears this. And we are also always crying because of our misery. We can't even take care of ourselves. When you say you have this meeting, the elderly people would say, just go and ask for euthanasia. Because elderly people now have no one to turn to. No one is helping us. We would prefer to be put down. We have worked very hard since our young age, but now we are too old to work. Please take care of us. Give us some assistance. Thank you. Thank you, Mr. Kwok. I hope no one should need euthanasia. Next, Mr. Ng Wai Tong from SOCO. Chairman, we are here to talk about the quality and regulation of private homes. I think this has been with us for 20 years, but the administration has done nothing. We'd like to ask a question. I agree with Ms. Edith Lee. Subvented homes are like 5-star hotels. The others are just guest houses. Does the government have the will to improve the quality of guest houses? Maybe not for the last 20 years. The law says that you can allow 1 to 40, meaning one worker taking care of 40 elderly people. So it is not possible for private homes to improve service. Maybe half of the elderly people need to have diapers changed, and one worker will have to do it for 20 elderly people. Now, I don't know whether the officials sitting opposite will use a timer to let me know how long the 20th elderly person has to wait. They say they do 7 rate checks every year, but let me know how long that elderly person has to wait. In subvented homes, it is 1 to 6 or 1 to 7. One worker taking care of 6 to 7 elderly persons, but 1 to 40 for private homes. So are you going to let us know when you can improve the situation? 1 year, 2 years, 3 years? That is before CY steps down. I understand we have a future fund. We have a lot of money in that future fund. Let me say I don't ask for 1 to 6, but only 1 to 20. This is a very difficult question to answer. Maybe you are not high-ranking enough to answer that question.
Recently, we visited some senior citizens, Mrs. Law, who was in her 80s, and she only waited for 6 months because and another person, Wong Mo Ming, who had suffered from a stroke. I mention these persons because Mrs. Law received CSS allowance of $6,200. She had to pay $8,000 to the home, including the charges for diapers. Mr. Wong received $4,600 of CSS allowance. He had suffered from a stroke. So for an amount ranging from $4,000 to $6,000, do the officials dare to recommend to the government that the staff to patient ratio should be changed from 1 to 4 to 1 to 20, given that the CSS allowance is so small? Like the second individual, Mr. Kwong, had pointed out, why is it that out of 13,000 people trained who were being trained, only 3,000 people came forward to work as health workers? So for those who are living in private homes, I think you should at least increase the CSS allowance by 50%. For the patient I refer to who had suffered from a stroke, now if you increase the CSS allowance by 50%, and then those who are waiting for the places in the homes will not be able to abuse the system. Let's say you increase the allowance by $3,000 from $6,000 to you increase it up to $9,000. 80% of the people living in private homes are on CSSA payment. If that's the case, it's possible to improve the quality service. Another question is whether the officials know about the fees charged by private homes. Actually, by how much more are they by how much more do they exceed the amount of CSS allowance that these old people receive? Thank you. We are a concerned group for the rehabilitated mental patients. In the RCHD, there are many rehabilitated mental patients. I understand many of these rehabilitated patients and their friends, and they've told us a lot about the problems in these private homes. Today, I'd like to make 3 points. First of all, many of them refer to the question meals. You may not have imagined that in these private RCHDs, I dare not say all of them, but I've heard that many of these RCHDs basically do not even offer the 3 meals. For example, the inmates will only eat fried eggs and sausages at night, but the fees they charge are not cheap at all. Very often these homes only have 1 or 2 staff, and they, not like the RCHEs, they do not need to hire many health workers or carers, because the staff will simply walk around in such homes practically doing nothing. But they still charge the full amount of the CSSA allowance and the disability allowance. And some of the inmates say that the charge, the fees are even higher than the CSSA allowance. And when LegCo approved the doubling of the CSSA allowance, then the fee that the homes would charge them the extra amount. You've all heard that the homes will simply make them pay the extra allowance that they have received. And thirdly, in these RCHDs, especially many of the rehabilitated mental patients, there are simply no rehabilitation activities. We understand that rehabilitated mental patients, if they really want to recover and integrate into the community and improve their quality of life, they need a lot of support. They need to work. They need to have a social life. But many of these homes simply lock them up. They would describe these homes as if it were a prison. They simply lock up in such homes the whole day long, walking around and watching TV, and these homes do not even welcome visitors. They would encourage visitors to simply talk to these inmates over the phone. For the private homes, the government should really work harder to follow in terms of monitoring the quality of these private homes. The government has not even come up with good short-term measures. The RCHD ordinance came into effect, Many of these homes are given a grace period of 18 months. The grace period has expired, but these homes are still operating. So how many of these homes are in compliance with the law? And also one more point, Chairman, if I may. The residential home for the disabled, I think there is a review committee which is in operation for a year, but they have yet to publish the report. So I really hope that they can come up with some proposals as soon as possible. Next, we have Ms. Chen Yun Man from the Concerned Group for Home Service of these homes. We've been in contact with many, single elderly persons who don't have any family support. Today, I'd like to share with you the experience of some of these elderly people when they need to choose homes. Many of them would like to rest, age in place, or stay with the family. But given the shortage of these homes, they are living in a very dangerous environment. While the physical health is deteriorating, they may still maintain a positive attitude. They try their best to look after themselves. Sometimes they may feel sick, they may suffer from pain, or they may be hard of hearing and so on. So the senior citizens would need to undergo assessment, but the staff of these homes say that they're still agile and therefore they don't qualify for any assistance. The senior citizens don't want to be assessed to be a disabled person or be stigmatized as someone who would cause trouble, and very often they would simply struggle, every day, despite the pain they suffer. There were some senior citizens. On one occasion, an old man, suffered from a lot of pain, but he dare not, call for help because he didn't want to give the impression that it was causing any trouble for other people. But I looked at the condition and then I arranged for referral. But when I referred him to the home said that he was not a chronic patient, he did not suffer from chronic disease, therefore he was not eligible for admission. I understand the social workers should prevent any abuse, but had the person who make the assessment, consider the hope, the wish of this 95-year-old person who wanted to be admitted to these homes. Is this old person abusing the system? Some senior citizens for an assessment system, I understand that you need to reserve the places to those in need. In theory, that is fine. And we also need to find out whether the senior citizens really have the need. But the waiting time is indeed too long. Mr. Nguai Tong referred to the case of Mrs. Law when she had been considered for 2 years before applying for a place in these homes. Eventually, she only was able to stay for 6 months when her health deteriorated. But the fees are so expensive; it could be up to $8,000 to $10,000, and her CSSA allowance was only $6,000. She believed that it was simply too expensive, and she didn't want her relatives to pay for the cost. So we hope that the government can come up with a timetable to increase the number of places in the subvented homes. Many homes have pointed out a problem of manpower shortage. I hope the government will consider, first of all, increase the amount of subsidy so that these homes, so that senior citizens can stay at the bought place residential homes. And as for the question of labor shortage, the government can consider directly subsidizing those who work in such homes so that more people will choose to join this profession. Next, Ms. Yong Lai from the Hong Kong Association of Gerontology. Our association have always been concerned about the medical the government's policy regarding the medical, the welfare and the medical needs of senior citizens. The government's document said there were 70,000 places in these resident homes. 20,000 are subvented places, including the enhanced board place homes. About 29,000 odd senior citizens are now on the waiting list, waiting for a place in the subvented homes. Waiting period is about 36 months. Altogether, we have 61,000 senior citizens who are now living in different types of homes, majority of whom are living in private homes. For these senior citizens, like many of the other deputations have said, have to rely on the CSSA assistance to pay for the fees. The private homes senior citizens living in these private homes do not have to undergo a detailed assessment. For their family members, they don't have information to help them find quality homes. Very often, they will depend on their personal impression and whether or not the CSSA allowance can pay for the fees of such homes. As a result, the homes that they choose do not offer satisfactory quality service. As a result, some of the homes with poor service quality can still survive. On monitoring the service quality of such homes, many of the such homes are regulated by the RCHE ordinance. Under the licensing system, ensuring the only required basic standard of operation, and you don't have any criteria to measure the performance. For the subvented homes and the board place homes, although they are subsidized and they need to comply with the SQS, but these only apply. They do not really, are not focused on the provision of long-term care service. So because of that, the service quality of these homes vary, and as a result, many of you have heard all the problems facing these senior citizens. Since many of the people living in the RCHG and RCHD don't have the ability to take care of themselves, including those who suffer from dementia or from strokes, I think the SLR government have the duty to monitor these homes. Our association would like to make the following suggestions. First of all, the government should come up with a forward-looking policy and set up a standing committee to monitor the provision of service for the elderly. And secondly, the government should address the problem of the short places and increase the number of subvented homes. And thirdly, there should be an assessment scheme to help enhance the quality of service. And thirdly, through public education, we should enhance the service users' understanding of the quality service in such homes. And fifthly, for all the we should implement quality management among all these private homes, and also resolve the question of manpower shortage and also the variation of quality service quality. Chairman, I'm Alex Lee. We all know that the private homes are seriously short of labor. Some intermediaries are offering so-called cardboard staff service. If there are any inspections, they should be surprise inspections. You shouldn't inform the home beforehand that you're going to conduct an inspection. Otherwise, they will enlist temporary help. These sort of inspection with prior notice does not help you know what is really happening in these homes. For example, like elderly people, taking the baths in a row, or they're having their hands and legs strapped and so on. So these will not help improve the service quality. As at the end of March, there are 748, RCHGs serving, and there are RCHDs, there are 300 odd such homes. Altogether, we have 1,500 carers who are being trained. The standard of these carers tend to vary, as some deputations pointed out. Of the 1,500 health workers are not enough to make up for the shortfall in manpower. Take this picture, for example. Old people are now strapped so tightly that they're suffering from bruises. So many of these, senior citizens are strapped to the beds and they're not allowed to walk around.
This is the result of the reduction of health workers in homes. Officials who are sitting opposite me, you should think of ways and means to attract new people to the trade. You should reduce work hours and provide a promotion ladder. You should provide more allowance, for example, to private homes. However, I object to the importation of labor. And also, I think the law is a big problem. RCHDs was passed, the law was passed in June 2011, but today we are in 2014. There are only 10 RCHDs which are licensed. 58 have been grandfathered. Well, they have the certificate of exemption, and it is good for 36 months. I'd like to ask you, Chairman, how can you guarantee a basic standard of living and basic living quality for the disabled? And also, it is said that the per capita space should be 6.5 meters square, but in a subvented home, it is 8 square meters. In other words, the law is stipulating a standard which is lower than that in reality. I believe you should upgrade it to 8 square meters per person. Next, Mr. Alex Lee from the Elderly Services Association of Hong Kong. In 1996, you have had the RCHD law and you have spent 18 years to monitor the private homes. But the problem has been with us, so can we still rely on the administration for monitoring? What is the source of the problem? Actually, a private home is just like a care and attention home. In 2013-14, in the Controller's report, it is said very clearly that subvented homes and bought places in private homes both are 7,800 in number. But in a care and attention home, the average subsidy is over $10,000. Together with land cost, it would amount to like $20,000. But in a BPS, it is $7,900 only. We are talking about the same degree of care for elderly people. Some of them, half of them, are enjoying service which is costing $18,000, but the other half, $7,900. This is so unfair. They are both elderly people. Why do they have to receive such different purposes? Is it that those who live in a bought place home are just second-class citizens? This is the difference between two types of elderly people in subvented homes. But in private homes, the situation is even worse. The rental itself would take up $2,000, $3,000 of the CSSA payment. And they have only like $2,000 from each elderly person. How do you expect the private homes to provide service that will cost them $10,000? Chairman, this all boils down to the fact that all these years, the administration has misdirected its resources. So in some private homes, you give them the land, you also allow them to do refurbishment at your expenses. But in the end, they do not have to accept the average citizen, but they can charge the inmates tens of thousands of dollars. So you are using taxpayers' money to build 5-star homes for the rich. How can you face up to Hong Kong taxpayers? Grassroots elderly people have nowhere to go. Our association thinks that you need to enhance the quality of private homes, but you should not monitor it. Rather, it should be monitored by the market. Like in Japan, the average quality of their homes is very high, but the government does not exactly monitor them. They just ask the homes to be open and transparent so the market knows how to make choices. So our view is that you should open up the elderly service market immediately and stop the injection of resources into subvented homes and protecting them. The resources should be spent on elderly people direct, so when they can afford quality service, those of poor quality will be phased out in the market. That will help to promote a good competition. Now, there is no justice. You are separating elderly people into different classes, and the life they have is totally different. Last but not least, Elderly Services Big Alliance, Mr. Guy Low. Chairman, I think you know that over 70% of those in private homes are on CSSA. The administration uses the private market to provide cheap services to the elderly. If it is inexpensive service, it is costing only a few $1,000s. But people will ask, what do you expect? I think two other speakers have addressed that point. In Hong Kong now, there are over 75,000 places, and 19,000 of them are subvented, or 25%. Very often, elderly people pass away before they can wait for a place. So why can't you buy more places? And also, you should pay much more than to a bought place so that they are akin to a subvented home, so that people have the money to provide better service. So since this is a bought place scheme, however, you give so little money to buy a place, and how can you compare the service, therefore, at a private home and a government home? As for land, private homes do not have land resources, and the government is not helping them. It is asking the private market to fend for itself. Just take a look at government leases. In the past year, how many private homes have been removed? Please take a very careful look. The Dill's Garden or Dill's Corner Garden home is to be demolished as well. So how can we have good quality homes? And also the manpower resources are a problem, as Mrs. Chan was saying. Very often is the elderly looking after the elderly. The support from the government is hugely lacking, and the industry cannot improve the quality of their manpower, so they cannot provide good service. You say you regulate them so quality service can be provided, but then you are just naive. You are just giving an account for the sake of giving an account to the public. In present-day Hong Kong, you allow private homes to become the safety net, but the poorest, those who have no help at all, have to resort to CSSA to pay for private home service. I think the distribution of resources is very lopsided, and there is no justice in society. I'd like to respond to a point in the past year or so. There are many bacteria or viruses which are spread in hospitals, and the hospitals are saying that homes refuse to accept elderly people who are affected by these drug-resistant bacteria or viruses. Okay, you only subsidize for the prevention of VRE, but maybe not for MRSA and other bacteria or viruses. Sorry, your time is up, Mr. Law. Please come to your final point or summarize. Ms. Lam talked about AIDS patients, that they are turned away by homes. This is because the government has not really educated the workers at the homes. They do not have the knowledge. They are stuck in the past when we knew so little about AIDS. Okay, thank you very much. Thank you, deputations. I will not do a long summary here because indeed we have been discussing this for 20 years. Can I ask the administration to give a response, and then we'll open the floor to members. Mrs. Chen. Thank you, Chairman. I'd like to thank the deputations for coming today. I have heard your views. I will now respond to a few points. First, deputations mentioned that elderly people would like to age in place. They would go to a home only when they cannot age in place. That is why we have more places for those who would like to age in place. And also last September, we started the approach of money following the user. And some deputations said, perhaps we should think about the assistant mode to homes. Perhaps we should assist the users instead of the homes. And what I said is exactly such a pilot program. And secondly, we hope in the community we can boost services so elderly people can stay at home. But of course, if it is no longer feasible to do so, they will still have to go to a home. And in fact, we have taken a multi-pronged approach in order to increase the supply of subvented places. I think we have provided a lot of information in the past at this meeting. And we do not only provide lip service. We continuously look for new land. We have 3 sites at hand. We'd like to build special purpose homes, and we also use the bought place scheme where resources permit to buy quality places in private homes. In the new financial year, we hope we can buy another 300 places. Just now, a deputation asked us to see whether we can look into the possibility of service vouchers. In January, the CE said in the PA that the Elderly Commission has been invited to investigate into the feasibility of introducing service vouchers for the elderly. At the same time, the Elderly Commission has been entrusted by government to come up with an elderly service plan. And this will particularly address the issue of premises, manpower, and the mode of service. They will delve into all these aspects. Many deputations also mentioned the issue of manpower, especially health workers. Indeed, under the law, we do not have hard and fast rules governing the qualification of health workers, but we encourage them to be trained. And also under the BPS, we have this requirement, and that is at least half of the health workers have gone through training. The SWD and the D of H provide training to in-service frontline staff every year, and on the average, over 2,000 places are provided. The courses will have to do with different aspects of the work at a home. We understand that in terms of manpower, many people say even the workers themselves are getting old. So we are actively looking how we can attract the young to join the trade. Starting from last year, the SWD has subvented a pilot scheme, and that is first employ, then train. We hired a batch of fresh secondary school graduates who will work in a home because they have been hired already, and then they will be closely supervised, and at the same time they read courses at the Open University. So they understand what it means to work in an RCHE and they will be gaining actual experience on the ground. Now, this will tie in with the qualifications framework, which is consulting the trade with regard to standards for providing elderly services. We hope that through the QF, those who would like to join the industry can see a prospect because they have a promotion ladder. And of course, today we are also talking about the quality of private homes. And actually, at the SWD, we have the RCHE ordinance, and there are stipulations there.
Yes, SWD has constantly been updating the guidelines for the homes. In different areas, we would enhance the quality service and also manpower training. On our part, and several deputations refer to the question of drugs. We do have a scheme to deploy pharmacists to help these homes to manage the dispensing of drugs. In the bought place schemes, through this scheme, we hope to be able to increase the supply of surrendered places. Also, through the scheme, we would want the service quality in the private homes could be enhanced. When we buy a place from private homes, the quality for the entire home would need to be upgraded to the standard which would qualify them for the bought place scheme. We also have some assessment scheme. You've just heard that the private homes also have the incentive to enhance their service quality. And we also recognize that in the BPS, if these private homes have gone through certain assessment procedures, then we will give them extra scores when we buy places from them. On the question of inspection, I'll ask Mrs. Lee to also, Mr. Lee to assist, Mrs. Lee to supplement. Thank you. Several deputations said that our inspections have been prearranged and that we will inform the homes beforehand. I can reiterate once again that all our inspections are announced before. We will not inform the homes beforehand of such visits. Well, this approach has been vetted by the ICAC and the Ombudsman. They both require us to conduct, unannounced inspections. So if you are aware of any homes which told you that yesterday or tomorrow the homes will be inspected, of course I have to say that in some cases we have reasons to check specific aspects of the homes and then we would inform them beforehand. But otherwise, normally the visits are surprise visits. Many deputations also refer to the question of manpower provision, especially the supply of care workers. If I may reiterate here about what is the minimum requirement according to the law. For these homes, now, say that the staff work at in different shifts. For the morning to the afternoon session, for every inmates, there should be for each carer he would take care of 20 inmates and not 40. In the bought play for homes under the BPS requirement is even more stringent. If a home has 100 senior citizens, the minimum requirement according to the law is that they need 10 care workers. Right now we will only buy places from A1 homes, and the requirement is that there should be 20 carers. So it's different from a home with only 10 carers. So from the government's perspective, we would like to commit more resources to enhance the quality of service in these private homes through the buying of places. Some deputations also said that some homes realize that they cannot satisfy our minimum requirements, and then they may need to be phased out. We hope to be able to help the industry to enhance their service standard. some deputations mentioned that the majority of the homes refuse to admit senior citizens who have been infected with the HIV virus. Thank you. I'd like to thank the deputation which brought up this case. Of course, I don't want to see any such cases appearing again. For some period of time, care for, I think in Hong Kong, I think we need to conduct further public education on how we should, care for the AIDS patients. So together with the Department of Health, we would jointly conduct training courses. In the past, the focus was mainly on infection control, or how do we take care of old people suffering from dementia, or how to make use of restraining devices and so on. I understand that the homes, especially those at the supervisory level, would also like to help the senior citizens. And senior citizens who have been affected by the HIV virus. So we would need to help their staff have the understanding so that they would take good care of these senior citizens. So we will be in touch with the Department of Health. But on the other hand, I'd like to emphasize also that for a licensed home, they would need to comply with the laws of Hong Kong. If they engage in any activity, or if they have not done certain things which would constitute discrimination, then we would need to tell these homes that they will have a criminal liability, including the consequence of breaching the disability discrimination allowance. Deputy Director, some deputations have asked a specific question. They have pointed out, and the media has reported, the names of many of these homes. So does the Bureau or would the Department or the Bureau have taken any actions to follow up on these complaints? You only gave your answer in principle, but will you be following up on these specific cases? In fact, some homes have admitted senior citizens who are HIV positive. We would encourage that, and also through training, we can, help eliminate the misunderstanding. I believe in many of these cases, is a question of misunderstanding. So we need to take some actions, but we will approach these homes and help them find out the crux of the problem. The concern group for HIV positive patients have also mentioned that HIV is not an infectious disease, and I don't think there will be any sexual contacts in such homes. So I think the staff should have the confidence. So I believe confidence is really, I believe training is the most important. It's something that we need to do. Assistant Director, again, you only, your answers are only touches on the principle. So you say you'll be sending out a letter to all these homes, telling them that old people, affected by AIDS, you should tell them that that these are the codes that they need to follow, and that they should not discriminate against such patients. And for homes which refuse to admit senior citizens suffering from AIDS, then if they're in breach of the law, you need to take action. So overall, I think the deputations have raised some very fundamental issues. For the private homes, be it the operators, the concerned groups, and the service users, they've all pointed out that there are problems with the service quality, and this has to do with the question of costs and the resources which are available to these homes. The system now almost always ensure that the service quality in these private homes are not satisfactory. In terms of, in terms of justice, even the private homes, the grassroots citizens will all go to the private homes. Those who have the means will be admitted to the self-financing R60s, where the fees would be would be up to several tens of thousands of dollars, and they're subsidized by the government. Now, manpower resources also cost money. So the deputations have raised a major issue. You tell us you've done A and B. That's what you've been telling us for 20 years. So when exactly are you going to really willing to face the issue squarely? Perhaps at this point I will open the floor to members. Shall I say 5 minutes for each member? Mr. Tam Yu Chung. I'll read out the names of those who would like to speak. Tam Yu Chung, Peng Chiu Ping, Leung Kwok Heng, and Deputy Chairman. Mr. Tam Yu Chung. I think we all know what is the nature of the problem. The question is how we can resolve the problem. Well, as to whether there have been any improvements, I believe there have been improvements, but it's not quite sufficient. The subvented homes and the private homes are different in terms of the resources available to them. To expect drastic improvements in service qualities for these private homes would be very difficult. The government is using the BPS to resolve the problem. I think this is one of the solutions. However, when you buy places from these private homes, very often their service quality is so poor that you would not want to buy places from these homes. As a result, those who go to these homes would pay out of the CSSA allowances. So we need to, tackle this problem. So could the government tell us about the assessment scheme? You're now recommending the homes to conduct some assessment on a voluntary basis, so that we can make it easier for people to select these homes. But how many of these private homes have taken part in this assessment scheme? The government told us that in future they intend to buy 300 more places. Would it be the case that it would not be easy for you to find suitable homes from whom you'll buy these places? And next, there is also the question of staff shortage. In Hong Kong, different industries are suffering from staff shortage. People are unwilling to work as dishwashers, not to mention working in these RCHEs where the working environment is even worse and the pressure is even more intense. So to find sufficient people to join to work for these homes would be difficult. So I think now if you are totally against the import of labor, I don't think that will work. I think the only solution is for us to import an appropriate amount of labor to fill the gap. We've once considered opening, leaving it to the market and the senior citizens and the families to make the decision, the so-called money follow the user principle. But it would appear now that the government is going to, try out the service coupon scheme, but the government is willing to let go, and then eventually, when the money is spent and yet the service quality does not improve, and the private homes will be able to pocket more money while service is not improved. So one has the impression that there had not been any significant improvements. So, we cannot do without supervision, because otherwise the problem would be even more serious. The Elderly Commission is now conducting a comprehensive review. I really hope that the Commission will really come up with some good recommendations so that there could be drastic improvements. Otherwise, we'll be going around in circles. We've made our criticisms, but the problems still remain unresolved. So my question is about assessment when you buy places from these homes. Mrs. Chen or Ms. Lee.
Let me talk about assessment. We now encourage homes to take part in accreditation or assessment voluntarily. On our SWD website, we have placed information of all RCHEs or RCHDs, and we also include the information to show whether a home is taking part in accreditation or assessment. So we like to enhance transparency that way. And also in all board place scheme exercises, we publicly state that if the home has been given recognition by accreditation or assessment bodies, it will receive a higher score. In the past few exercises, 11 or 12% was achieved, but still this is voluntary. Also recently, the Hong Kong Accreditation Service did tell us which are the bodies that can do accreditation and assessment. So later on, when homes need accreditation or assessment, they should go to recognized accreditation agencies. Then we may attach more weight to the scores given by recognized accreditation agencies. This is a big step in enhancing the quality of homes. Can you let us know how many private homes have been accredited or assessed? We do not have the figure here, but it is on the SWD website. I can supply the figure to you after the meeting. Mr. Tam also asked you whether the places would be too expensive for you to buy. Well, that's correct. When we buy places, the places must be up to standard. If we have the resources, we don't want to spend them on substandard places. Starting from 2011, and in the 3 exercises that followed, we were able to buy places. In 2012, we upgraded the Group 2A places. So you can see that there are more places in A1 than in A2. In the past, the reverse was true. So we like to take steps to help homes enhance their quality. Mr. Poon Siu Ping. Thank you, Chairman. I'd like to thank the deputations for coming to speak to us. They reflected to us what problems there are. And now I'd like to ask a few questions for the administration to answer. Number 1, in para 2 of your paper, you say that 75,780 places are in RCHEs. They are serving 61,200 elderly persons, meaning that the usage rate is only 81%. I'd like to know where the vacancies are. Are they concentrated in certain homes? Number 2, I talked about a survey. The department said that it was always a surprise check, but then the deputations are saying that it's not the case. In para 11, the irregularities, you say you also take out prosecution, and 35 were successfully prosecuted involving 46 offences. I'd like to know what offences were these. And did the homes concerned improve after having been prosecuted? And number 3, as the chairman was asking, this is about AIDS. The information from the deputations is such that they have asked around, but only 6 were willing to accept AIDS patients. 3 are in Sham Shui Po. So you can imagine many are turning AIDS patients away. Will you do a further or another survey so you can come to grips with the homes that are refusing to accept AIDS patients and why? Assistant Director, the simple answer is that most of the vacancies are in private homes. As for prosecution, usually the offences have to do with a low supply of workers or submitting false records of meetings, and also they did not comply with the direction that they should rectify certain measures according to the directions of the director. We will step up our inspection of these homes if they have been found to be guilty. We hope that through our strengthened or enhanced inspection, the homes would be kept on their toes. So those were the main offences that were prosecuted. What about AIDS patients? Mr. Poon asked whether we can do a comprehensive survey. I believe since we already remind them that they might contravene the DDO, and if we go and do the survey now, I'm afraid they will not be honest in telling us that they will turn away AIDS patients or other elderly people who are sick. But Chairman, I agree that we should issue notices or guidelines to remind them how they should manage elderly people with AIDS. We hope the homes will then be more willing to accept the elderly people concerned. I think it will be more direct than having us ask around again whether each home would be willing to accept elderly people with AIDS. I am afraid that survey will not be very helpful. Mr. Poon, in other words, you only wait for complaints, is that right? Or else you are telling us that it's very difficult for you to tackle this question, is that right? As I was saying, if anybody speaks openly that he or she will not accept any such patients, I think that can amount to a contravention of the DDO. And as I have always said, perhaps we can use the code of practice or guidelines or notices to remind them. I will remind them to be more open. I think that would be better than asking around whether they will refuse AIDS patients. Mr. Leung Kwok Hong, Chairman, I have always read this out in the recent filibustering exercise. In the manifesto for election, C.Y. Leung said this: in the long term, we should study how public finances would be affected by aging of the population. We should put aside enough provision in order to set up an elderly fund in order to take care of the extra costs that will be needed for taking care of the elderly. We are talking about money now. In the budget, it is said that there could be money set up for infrastructure. If you have $220 billion, that is what the administration has. Do you think the deputations, would you be happy if they give you just a small chunk of that? And then in his manifesto, he also said that looking at the situation of mismatch of resources for elderly services, we should provide aging-in-place services and also respite services. And we must pay particular attention to housing and care needs for the grassroots elderly. We should provide land to build integrated service centers for the elderly. Look, this is so attractive. It sounds so magnanimous. Of course, everything boils down to money. The poor will get assistance from the government. If you're even poorer, you go to the Board Place scheme homes. Is that what is happening? I'd like to ask the officials, do you have a rough estimate? How much money do you need in order to solve these problems? He also said to provide land to build an integrated elderly care and housing home. You have been in the post for 2 years. Do you have the land that C.Y. Leung talked about? Mrs. Chan? Thank you, Chairman and Mr. Leung. I think at this joint subcommittee, I said that every year the administration is wiring more resources for elderly services. This year, we have put aside $6.23 billion for elderly services, and about $4 billion would be for the provision of institutionalized care. Where resources permit, we'll continue to provide more places, especially surrendered places. Mr. Leung asked us whether we have put aside land for building more homes. Well, yes. In different papers, we have already said that at least we have 11 sites which can definitely be used for building homes. But that figure is subject to change all the time. Whenever we find a new site, we will add it in. Okay, you say you have $4 billion, but compared to last year, how much more is that? You say you have 11 sites. How many elderly persons can be accommodated? Our estimate is, well, it has to depend on the situation on the ground. We estimate that we can have 1,200 places. But do you know how many elderly people pass away every year without waiting for a place? I get it. I get it. Yes, Mr. Leung. I don't think you are helping to solve 1/3 of the problem. Chairman, Mr. Leung, and deputations. We build new contract homes, but that is only one way to provide places. As I said, we are going to buy more places, and also in surrendered homes we can make better use of space so we can add places. And maybe you have heard this. We have a special scheme which is for making the best use of land, which is in the hands of NGOs or the government, and that is through redevelopment or rebuilding, we can provide new places. At the LegCo in February this year, the FC approved us the application to inject $10 billion into the lotteries fund. That is for this plan. We hope that in the next 5 to 10 years, we can provide about 9,000 new places for the elderly. We understand that the elderly population is growing. So whether it be institutions or community care, the demand will increase, and we'll continue to work hard to find resources. Are you talking about 10 years? I don't think C.Y. Leung will be there. At most, he has another 7 years, even if he has a second term. 7 or 8 years. When you talk about 10 years, it has nothing to do with this term of government. Chairman, Mr. Leung, if I remember correctly, I think the deputation said that providing elderly services is something for the long term. We should not change the plan just because of a change in the seat of government. I think that undertaking is going to stay. Mrs. Chan, relying on the government to provide surrender places and bought places, I think that will only amount to a drop in the ocean. You said that $4 billion out of the $6.2 billion would be used for providing more places. However, if you provide good community care, elderly people do not have to be institutionalized. That should be the last option. However, 2/3 of the resources for services are put into the provision of places. If you say aging in place should be the mainstay and institutions would only provide a backup role, I don't think the resource distribution reflects this. If you have better community care and if institutions should be the last option, then you should swap the proportion of resources. This is what Mr. Wai Leung said, to formulate a long-term care plan and to tackle the mismatch of resource problem.
So you've been making the adjustment for 2 years, but it's still like this. So is it still 2/3 versus 1/3? I've read his manifesto. He said clearly that there is a mismatch of resources. So why is it that you still, out of 6.2 billion, 4 billion will be spent on the homes? I think community care and residential care, what exactly is the strategy? Thank you. Yes, Mr. Chairman. I said of the 6.2 billion, 4 billion will be spent on places in such homes. It's not a question of resources being, allocated in a lopsided manner. The homes provide for a 24-hour service, and the resource requirement will be larger. But I also agree that community care, I think we've done a good. We've not done good enough in terms of community care. We need to do better. And that's why we are now obtaining more resources to provide for 1,500 places for to train up more care workers. So through these services and the elderly want to age in place, we can provide more resources to support them. But I do not have the information regarding the new resources for this year. The 15,000 places for aging in place. You're going to put it, out for auction, and you're going to outsource the service, and I think it will create a lot of instability. I think the welfare panel will follow up on this in due course. Deputy Chairman, I may need a bit longer, Chairman. Like you said, we'll be discussing the question of, home care services on the 9th of June. Even if 1,500 places, how are you going to distribute them? The 5,000 odd places, you go for, you only, if the care workers are replaced, and then the citizens will again apply to be admitted in these homes. So we'll talk about this in detail on June the 9th. Soko, I'd like to ask you about the prices of these homes. I did conduct a consultation, and the response I get is that 50% on senior citizens who are not disabled, 2,405 are living in private homes, paying $4,000 odd, close to $5,000 per month. For these old people, they're not that many in number, but 2,000, there are more than 2,000 of them is still deserve our concern. Of the 500 odd private homes, 214 charge a minimum, which is more than this. Or out of the 10, for 4 of these homes, the old people have to pay extra on top of the SSR allowance. Mr. Kwok told us that he has to pay extra. Once you have to pay extra to make up the shortfall, that would be in breach of the law, because of course you can deny that, but I think you have to report to the SWD when you use the SSS allowance. So I don't know whether that. Well, I think we're talking about a major, trap here. Many families may not know this. I mean, they have always been an accomplice. They have been accomplices for a long time. So how is there such a trap in the law? And have you ever prosecuted people for not making the declaration and pay extra to these homes? And secondly, the new People Party proposed that we should increase the allowance for $1,000. Soko said that there should be a 50% increase. I've done my calculation. I think for the amount of CSS allowance spent on private homes is about $2 billion being spent every year. So it's entirely CSS allowance spent by old people living in private homes. If the amount goes up from $2 billion to $3 billion, can we really improve the service quality? For those who operate private homes, could you tell us whether or not that could help improve service quality? And finally, question for the administration. So, how do you respond to the demand that we should increase the space per capita, and would you consider that? Thank you, Mr. Chan. Or rather, thank you, Deputy Chairman, for the information which you provided. Perhaps I can also make two more supplements. The Chairman just now talk about able-bodied citizens or those who are 50% incapacitated. So the average CSS allowance that they receive is about $4,900. Of the 500-odd private homes, 200 of them said that the minimum charge is more than the average CSSA allowance. But in fact, many of the senior citizens are already 100% incapacitated, and the CSSA allowance they receive is close to $6,000. So of the 500-odd private homes, 55 charge a fee that is higher than the average CSSA allowance. Some senior citizens require, some constant care, and as a result, they are collecting CSSA allowance of $7,000, and then only 10 private homes would charge more than that. Old people collecting CSSA. There are also other, fees and expenses incurred that are accountable. For example, costs for medical equipment and so on. As whether or not the family will give monetary assistance to the senior citizen. Would that be in breach of the law? According to the CSSA ordinance, we're asking the question is whether or not the old person has other resources. If the family recurrently provide financial assistance to the citizens, it will count as part of the recurrent income. So this is the point that I'd like to clarify. The Deputy Chairman asked whether or not you have had such cases where you have discovered such cases. I don't have the information offhand. Perhaps I would need to ask our colleagues from the CSSA division as to whether or not there have been any such cases. Mr. Tang also asked a question about increasing the staff to patient ratio, and the Assistant Director told us that the amount of CSS allowance basically would be sufficient to cover for the fees charged by private homes. And I think, and this is new to me, so any response from the deputations? Please put up your hand and I'll... okay. Shall we need to adjourn at 4:30. I wouldn't be able to accommodate each and every one of you, so I can only pick a few of you to speak, and I can only give you 1 minute each, because we really need to, surrender this venue at 4:30. At the very back, Mr. Alway Kai. 2 minutes. Sorry, 1 minute. Chairman, I'd like to talk about the HIV, old people who are HIV positive, and the biggest problem now is that our frontline workers is the psychological, the mentality of our frontline staff and whether or not they accept these people affected by infectious disease. The SOPD has not done enough on its part. The homes are willing to provide the service, but eventually it is our frontline staff who serve these old people. In the private homes, other than those with bought places, only the A1 homes would have nurses who are resident. So and then these nurses can educate the other staff in such homes. For the other private homes, they do not have nurses or professionals, so they get very limited education from the SWD. The frontline staff very often are simply, from the grassroots. Many of them are new immigrants, so they really lack such knowledge. The industry would like to work with the government, and we think that the old people should not be discriminated against. Yeah, you don't even have nurses. For the A1 homes, only a few A1 homes which have nurses. For the other private homes, how can you help the frontline staff to overcome their misunderstanding? Well, I asked two questions which the administration has not answered. We know that I'm asking about the old people living in private homes. 80%, how many of them are paying fees which is more than the CSSA allowance they receive? So for CSSA recipients, the allowance are not enough to pay for the fees. So how are we going to make up for the shortfall? Other than relying on the savings, of course, they would have to turn to the family members. So on the one hand, we want the government to investigate. On the other hand, we don't want the government to investigate. And secondly, the staff ratio of 1 to 40. And you told us that for some homes it's 1 to 20. Our question is that the minimum is 1 to 40. When would the government have determination to change that to 1 to 20, or not to mention 1 to 7? Of course, the bought place homes have other means, but when are we? Well, we can only improve the service quality by improving on the law. But I don't think the government has answered the question. Ms. Yong. Thank you very much, Chairman. Our Society of Gerontology can perhaps help answer the question. From 2002 until now, there are 115 subvented and self-sufficient RCHEs. On our list, there are 45 such homes which are still valid, of which 20 to 30 are private homes. So this is a scheme based on voluntary participation. Some of the homes might have participated once, and they may not be willing to participate again. For those who have participated in the scheme, they've told us that the scheme has helped them improve their service quality. We hope that the government can also help promote this scheme so that the private homes, if they're interested and if they have an intention to improve their service quality, we can also allow the private homes to operate under proper supervision. So I hope the administration will pay attention to that. I hope also the government can promote your assessment and accreditation scheme. But I don't think the government has really, listened to those in the industry. I'd just like to tell the government that when the HIV positive senior citizens are rejected by these private homes, they dare not complain because they're already being stigmatized. I hope the government can come up with specific actions to help these people. And regarding the officials' response that there are already 6 homes which accept HIV positive patients, I think the focus should be the question to ask is whether or not why there are homes which refuse to accept senior citizens who are HIV positive. Finally, we hope the government will, when a problem has arisen, the government should come up with specific actions to respond. I'd like to thank all the deputations for coming here to give us your comments. We've been discussing this issue for 20 years. The government have, made some piecemeal efforts, but the problem is not really totally resolved. Mr. Tam Yu Chung already said that the government would need more determination and take more drastic measures to tackle this problem. We are a cosmopolitan city. We don't want old people to suffer so much in the twilight years. If an old person trips and falls or suffer from a stroke or suffer from dementia, if the family cannot take care of them, then the only recourse to them is the private homes. But the service standard varies so much among such homes, and the government doesn't seem to have the determination to deal with that. And this is the point that this panel is most concerned about. Even if you're going to buy a few 100 more places, and you're only talking about a few hundred additional places every year, where the shortfall we're talking about is several tens of thousands. So we have a big gap there. We don't have enough time, I'm sorry, today. So the views expressed by the deputations today will be collated, and we hope that the government can give us a response. After this working group has finished with work, we will draft a report, and we hope that by way of a motion debate, Legislative will accept our report, and then the government will respond officially to that report. With that, I think we may now adjourn our meeting. Thank you.